Dr. Martin indicated that the swine flu and other viruses that are new to the region pose additional challenges. He said already measures have been implemented at the island's ports of entry to deal with the risk associated with interregional travel, particularly to and from regions that have recorded infections of the H1N1 virus or swine flu. He said the Ministry of Health is working closely with regional public health agencies to ensure that health professionals in St. George's have the most up-to-date information.
As it relates to infectious diseases of that nature, that is always a reality of our situation, and not just Trinidad, because we have direct flights from other parts of the world as well. So the answer is yes, this is always a risk that all countries will face, and hence the reason that we have to continue to see how we can keep our surveillance up.
Dr. Martin said the travellers should be willing to provide information to the health personnel stationed at the ports of entry as part of the efforts to keep the virus out of Grenada.
It's difficult to isolate people by just standing in the line, because viruses are viruses. They all have similar symptoms to begin with, unless you test and identify one over the other. At ports of entry, what happens is that health facilities or personnel, environmental health or nurse personnel that are there, share information with people in terms of giving them cards and information leaflet, saying to them that if you have any of these symptoms, a cough, a fever, something that is unusual, then you should seek medical attention urgently.
The health official says personal responsibility will reduce the impact on Grenada and on the health sector.
The pressures for the health facilities and personnel keeps increasing as time goes by, because more and more is being required in terms of educating people. More and more is required in terms of if we have to give treatment, in terms of reporting and so on. So it is causing additional stress. However, it is important here to highlight and to reinforce the fact that we've been trying to have people take some responsibility as well, because if people do take responsibility, it kind of helps the health system. If persons recognize that they need to practice themselves good cough etiquette and avoid exposing themselves unnecessarily to disease conditions, washing your hands, or not just washing, but hand hygiene and cough hygiene. If people take that kind of responsibility to try and not expose themselves unnecessarily, that helps to decrease the burden to the health system and the health personnel.
Joseph McKee-Smith, GBN News.